Hello, you're watching Sightline on MNB World, an interview program that invites various guests for a conversation on important theme. And today in our studio we have Dr. Denise Burnette, Professor of Social Work at the Virginia Commonwealth University. Hello.
Hello, it's nice to be here.
Thank you for accepting our invitation.
My pleasure.
Dr. Denise Burnette is the Samuel Wurtzel Endowed Professor of Social Work at Virginia Commonwealth University. She has extensive social work practice experience in medical and public psychiatric settings, and she has taught extensively across Master of Social Work and PhD curricula and in related disciplines. Dr. Burnette has held year-long senior Fulbright research fellowships in India and Botswana. She also served as an international scholar with the Open Society, where she coordinated social work programs in Central Asia and the Balkans for almost a decade. She holds a certification in management development for college and university administrators from Harvard University and is a professor emerita at Columbia University School of Social Work. Well, let's start our interview from the purpose of your current visit to Mongolia.
I am here on a Fulbright fellowship, and for those people who may not know about the Fulbright, it is an educational and collaborative program with other countries. Currently, there are Fulbright specialists, which I'm here as a Fulbright specialist, in more than 150 countries. And the Fulbright program is run by the U.S. State Department, the Bureau of Educational and Cultural Affairs. So I'm so pleased to be here.
You have just mentioned that you are conducting a workshop for the Mongolian medical and health professionals, and we have just learned that the theme of the workshop concentrates on improving quality and access to care by aligning social and health care. Can you share with us what are the benefits of aligning social care with the health care?
Sure. So social care and health care, or social and medical care, are very complementary, and they actually very much influence one another. So there are theoretical reasons for combining or aligning these different approaches to care, and then there also are practical reasons. So from a theoretical perspective, social aspects of our lives influence our health through health behaviors, through social participation as opposed to social isolation and loneliness. So all these social factors deeply influence one's health and morbidity and mortality. So your illness, the rates of illness, and also death rates. From a very practical perspective, I also think that the alignment and integration of social and healthcare are much more create a much more efficiencies and a much more effective system of care, because it enables us to develop more targeted and efficient interventions for people who are at social risk, who then experience health problems, or people who are at health risk who then experience social problems.
I see. And when we were preparing for the interview, one of the models were like improvement of public health by integrating psychosocial principles and models. Maybe our viewers are not familiar with the term psychosocial models. Can you explain to our viewers about this terminology?
So in public health, and also in healthcare more generally, the approach to care, the optimal approach to care, is referred to as a biopsychosocial model of care. This is care that integrates a multi or interdisciplinary team that addresses the mental health issues, mental and emotional health issues of patients or of people in the community, and also their health concerns and also their social well-being. So it's a multifaceted biopsychosocial model of care. And at any place where one intervenes in that system using this model, you can intervene at a medical at a medical level and influence social outcomes and mental health outcomes, or intervene at a social level and influence mental health outcomes or health outcomes and so forth. So the biopsychosocial model is probably the most prevalent and the broadest. It's also very important, of course, in using models and developing models and applying models, to do so in a culturally appropriate and culturally sensitive way. So you may have a model that works in some areas or some countries or some regions that may not work as well in others, because you have different health beliefs and different cultural beliefs and different cultural practices and different illnesses in different contexts.
We recently talked about like aligning social care with the healthcare. Is there like any successful examples of countries that made it possible?
I think that the World Health Organization in general has done the most effective job of trying to develop models that integrate. Countries in the West have done, in some respects, have done a better job because they have more resources. But on the other hand, countries in the West have a lot to learn from still developing from developing countries or less developed countries, because these countries and these cultures have learned new ways and novel ways to meet their needs that have not been addressed empirically.
For the past couple of years, the global community has suffered a lot due to the global pandemic, COVID-19.
Yes.
And there were a lot of situations like lockdowns, restrictions.
Yes.
And as a professional who studies social work, what kind of changes it brought to the society?
The first thing I would say is it has brought profound changes, and I don't think we even yet can anticipate what those changes, the long-term changes, might be. I would say that some of the main changes are economic, and there also have been very profound health changes, population health changes that are relevant to and are related to the economic changes. So the estimates are that from the World Health Organization are that more than 120 million people have been pushed into extreme poverty by the pandemic. There also are psychological and social issues that affect people's physical health, like social isolation, this lockdowns and isolation and loneliness and inability to see family, that have increased both disease and death rates.
Like in times of major issues such as like climate change, pandemic, or economic crisis, how can we address such health inequalities that are created by such macro major issues?
Well, that's a very good and a very difficult question. I don't think I have the answer to it, but I would say that approaches to inequalities need to be, in all contexts, need to be top-down and bottom-up, meaning that interventions should be scheduled, should be planned, and should be conducted at the individual, family, and community level, using advocacy and using approaches that involve people who are affected in making decisions and in advocating for their own needs. Top-down obviously involves policy and health policies and economic policies particularly that address economic inequalities and health inequalities.
When we were preparing for the interview, we have learned that you have been working in Mongolia since 2000s, and in 2009 you have conducted a lecture in Mongolia for medical professionals about the quality of life and mental health. And what are some key mental health challenges faced by older adults nowadays, to your opinion?
Yeah. So I would say, first of all, that there's a difference in length of life and quality of life. And so if you ask someone, if I ask you, how long would you like to live? People usually say, as long as I can have a good quality of life. That it doesn't, I'm not that interested so much in living long time as I am in living a high quality life. So again, the World Health Organization has 4 domains of quality of life. That in order to have a good quality of life, one needs to have a good social life, a good psychological and mental health, good physical health, and a good and supportive environment, a social environment and physical environment that promote good health. So I think in Mongolia, the issues of quality of life are very important, and especially for older people. I will say that too, in terms of life expectancy, that Mongolia does have, there are measures of life expectancy and then measures of healthy life expectancy. So healthy life expectancy is the number of life years that you have without disability or disease. And Mongolia has the Mongolian men have the lowest
life expectancy.
The lowest healthy life expectancy in Central Asia, and women have the 3rd lowest healthy life expectancy in Central Asia after Tajikistan and Uzbekistan.
And for your opinion, what causes such low life expectancy?
I think it's a combination of things. It's rarely just one thing. I think one of the major things now is chronic health conditions, non-communicable diseases like heart disease, liver disease, cancer. These non-communicable diseases that are related to each other and that also are related to lifestyle and health behaviors. And I think also, not just in Mongolia, but throughout the world, there really has to be an emphasis at the policy level on equality and equity and quality of care for the whole population, and
whole
not
community.
Just for and not just for select few.
My next question will be related more to technology. And nowadays we live in a technological area with digital communications, and there's a lot of social media platforms. And what do you think, what kind of effect social media has on the quality of social life and the quality of mental health of people?
Good question, a difficult question. I think that I just read an article about the first generation of social media children is now starting to come of age, and there are many concerns about their mental health, depression, privacy issues and concerns about privacy, where things have been documented about their lives when they were young children that are now permanently available on public media. I think social media is like, in some ways, like artificial intelligence, and some of the concerns that we have about the advent now of artificial intelligence, that technology can be a really good thing and can really equalize the knowledge and opportunities for a population. It also can be very detrimental to certain populations. There also is, I would mention, still a technology divide. And I notice that everyone is on cell phones a lot. Yes. I don't know in the rural areas, more rural and remote areas, or among herders and pastoralists, how common it is to have access to
technology,
to advanced technology and media.
Well, maybe during the younger generation has more access to the technology compared to the older herders.
Yes, yes, I think that's true.
And that leads us to another question. In 2013 or 10, you have publication on life satisfaction among rural and urban older adults in Mongolia. Can you share with our viewers about the interesting outcomes from this publication during the research of doing this publication?
Sure. So this was a study in which we had a lot of interest in the difference, to see whether there was any difference in life satisfaction between rural and urban older adults in Mongolia. So let me first say what life satisfaction is. So when you ask someone how satisfied you are with your life, it is a global measure of how content you are with the life that you have lived in later life. So you look back and say, I've accomplished things, I've lived a good life, I've raised children, I've done, what I wanted to do. So it's a single item that measures global life satisfaction, or global satisfaction with life. There are multiple, again, different areas that contribute to life satisfaction. So we looked at some background demographic variables like gender or sex, education, living environment, some background factors. We also looked at health and at a couple of social measures, loneliness and social isolation in particular, and then we compared rural and urban areas. And what we found was that the factors that contribute to that contribute to life satisfaction in later life are better self-rated health, which is not surprising. So having better health
gives
is related to better life satisfaction, higher levels of life satisfaction. It's also not surprising to know that education, higher levels of education, also are related to better ratings of life, life satisfaction. In the social area, the social measures that we had, loneliness had a very strong relationship with poor life satisfaction. The more lonely you are, the less life satisfaction you have. And also social participation, participation in your community and in social activities, religious activities. The less you participated, the lower your levels of life satisfaction. And then in social science research, what you can do is control for all of those factors and then and then look at, even with all of the effects of all of those factors held constant, does it matter if you live in a rural or urban area? And what we found is that it does, and that actually people who live in rural and more remote areas in Mongolia have significantly worse levels of life satisfaction than people who live in urban areas.
Because they're not close to the infrastructure, opportunities, access to education.
Yes, for all those reasons. And I'm glad you mentioned the reasons, because those are all areas that you can then target, and that's why it's important to do this kind of research, because it enables you to ask the questions then, what is it about rural life that makes their level of life satisfaction so much lower? And then that allows you to, infrastructure is a big one. Obviously is a very big one.
And it also allows policymakers to make changes in order to improve the lives of people.
And to target certain policies.
Let's continue our talk about the workshop you are currently conducting.
Yes.
And what are the main points of the workshop, main themes?
So I've done two major workshops. I've done one, and then we'll continue on this week to do another. So the first one was on research methods, on qualitative research methods with faculty in the School of Public Health. So we looked at various methods for inquiry using qualitative research methods or approaches to research in Mongolia. And the second workshop, which we'll have on Wednesday, is focused on older adults and on working for practitioners and educators, and it's how to work with older adults, how to do an assessment, how to engage with them, how to do an assessment, and also some of the best practices and empirical work based on empirical work that's done with older adults.
You have been conducting workshops for foreigners, like who took part in a Fulbright program. And how many countries have you visited and did such a workshop? Yeah.
So I I did a year-long Fulbright in India, and lived there for a year and did a lot of workshops and helped to develop a doctoral program at the Tata Institute of Social Sciences in Mumbai. And then I also did a second year-long Fulbright in Botswana, in where we worked on, I was placed with the Center for HIV and AIDS prevention and intervention, and we worked on older adults, the issues of older adults who were people who were aging with HIV. And then a lot of work in Mongolia over the years, and in Central Asia.
It's really nice to hear. Well, thank you for coming to our studio and sharing about your work.
Thank you very much for having me, and I really appreciate it, and I wish Mongolia the best, and look forward to continuing our relationship.
Well, thank you for staying with us on MNB World. That was the new episode of Sightline. We'll see you next time with more stories and updates. Have a nice evening. Goodbye.